Good evening. This is October 3rd, Tuesday, October 3rd. Time is 4:54 in the afternoon. This is the Acushnet Board of Health. We are being audio and videotaped. I'm Dave Vignan, Chairman. To my left is Mr. Fortin, Tom Fortin, Board Member, our agent Joe Correa, and Wanda, our Secretary. So with that being said, first order of business, letter from Community Nurse and Home Care Statistics for August of 2023. They changed the forms? They look different.
Yeah, they updated it a little bit. Different nurse.
A motion to place that on file?
I'll second the motion. All in favor? Aye. Motion carries 2-0. Second item, Massachusetts Department of Public Health, the virus report.
So, just need to notify the public that at this time, it's still, mosquitoes are really still going, so you
Yeah,
have to
so
warn people to spray and make sure you pay attention.
just so the general public knows, the number of mosquito samples tested, 9,891, so nearly 10,000. Number of West Nile virus positive samples, 147. Number of EEE positive, 17. So they're low, but still
Yeah,
there.
It's,
It's there.
this is the time of the year, and this is from last month. This month will be coming out. We've been getting notified that we have not in Acushnet got any positives on EEE or West Nile, but it's all around us. So this is the time of the year where EEE and West Nile are at their highest in the fall. So it's really important to, again, be aware, make sure that you wear your spray, cover up, do what you have to do to make sure that you're not getting bit. And just as much as ticks are still very, very, very much there, and they will be there until the first, and the same thing with the mosquitoes, until the first hard freeze. And you know, ticks are just as concerning as
Yeah.
mosquitoes.
Very concerning.
Yeah, I noticed the 17 EEE positives were from Hampton and Worcester counties. But they don't break down the other three for West Nile. They just they cover all the counties.
Yes, yeah, they cover the counties, but if we're getting, we get notified if there's a hit in our community, and we haven't got notified that there was a hit in the community for either one, but it's been Freetown, it's been Easton, some of the ones that just popping off the top of my mind. We haven't got it, but it's around us.
A motion to file it?
I'll second the motion. All in favor?
Aye.
Motion carries 2-0. Next on the agenda, septic design plans. We have 3 plans ready to be approved. 5 Perkins Lane, 232 Hamlin Street, and 19 Beechwood Drive. All 3 plans have been reviewed by all the board members, and I'll accept a motion to approve all 3, including variances
I'll
requested.
make a motion to approve the 3 plans with the variances.
I'll second the motion. All in favor?
Aye.
Aye. Motion carries 2-0. We have 2 other plans that have been reviewed, and just require some minor tweaks to the plan. I'll accept the motion to approve those and have Joe sign them on behalf of the board once the revisions have been passed along to each board member.
Yeah, that way they don't have to wait till the next year. I'll make a motion to approve those 2 plans.
Subject to?
The changes.
Okay. I'll second the motion. All in favor?
Aye.
Motion carries 2-0.
I think I'll make a motion also to have Joe sign those plans, those 2 particular plans.
I'll second the motion with the caveat that we get to review and approve them individually.
Yep.
Second motion, all in favor?
Aye.
Aye, motion carries. Let's get the minutes out of the way. We got August 1, were me and Tommy both there?
I wasn't at
No.
that,
Oh, okay.
so I don't think.
That's
we can
right.
approve.
That's right, that was my one comment, that on the top it said that you were there, but you were absent too.
Yep.
Well, you got it out of the way.
All right, so I'll make a motion that we table the minutes until the next meeting when Mr. Maderis is here.
I'll second the motion.
All in favor? Aye. Motion carries 2-0. We have several discussion items. First is flu shots administered by Christy McMillan, RN, along with student nurses at the Acushnet Council on Aging, 59.5 South Main Street, on Tuesday, October 10th, at 9 a.m. to 11 a.m. Do you want to add anything to that, Joe? or-
Yeah, well, yeah.
We
We
have-
have a sign, yeah. This, Christy McMillan is our shared nurse, and she has just been absolutely excellent and really pushing ways to get into the community and do extra work. The collaborative that we have between New Bedford and Fairhaven and ourselves also, I mean, that group is really, all of us are working together to try to really bring more services back into the town, some of which we've lost over time because of money. This is not costing us any money. The nurse is not costing us any money at this point in time. It's through a grant. And she's just turning into a rock star. She really pushed her way in to want to do flu shots and COVID shots for homebound people. We've been looking into, and we can, I don't know if you want to talk about that high dose vaccinations too. We might be able to take both of those.
Okay, well,
Yep.
the second bullet item is purchase of high-dose vaccines, 60 doses at $3,700.
Yeah. It's a high dose flu shot, and what we're doing is working with the other towns, with the city and the town, to be able to go and deal with our homebound people. These particular high dose vaccinations, which is recommended for anybody 65 and older, and in talking with Heather at the Council on Aging and really trying to put together what we're looking at and what we need for vaccine, because there is regular flu vaccine, and if we need that versus the high dose. Most of Heather's clientele is over 65, and they're the ones that receive the flu shot. Most of the people that are homebound receive the flu shot. It has to be, it's recommended to be high dose. So in that collaborative and discussing what we need, we looked at the fact that usually there's about, at least at the flu clinic, there's about 50 people that show up every year. And then they leaves 10 there for homebound people. It lasts for a year, and it's, you know, it's $64 a dose. And so it's $640 for 10. So yeah, I believe that's it. So that's where the 3,700 comes from. Now, we've taken a look at that in regards to where we can get that from. I think we've discussed that before. We have, it's not in the proper form, but it's in our nursing because of the fact that we had to elevate our nursing line item because of COVID. And we still have a tendency to take a look at that, but we still have to be concerned about that type of situation. But with our own nurse now, being able to work with the community nurses, I believe that it's going to significantly downplay how much money that we have to spend on nursing.
On the nursing contract, because
So-
they bill us by the hour now.
Yes,
Yes.
yeah. So what we're doing is we're gonna shave a little bit off of that in
Offset.
order to put
Okay.
it into this. And if the you know, this flu clinic and the interactions with the residents start to really spin up in a positive way, then we can take a look at, you know, rerouting some of that money next year and putting it into, you know, actual cost or expenses associated with it. We're also, and this is a wonderful thing about New Bedford, is New Bedford, we always, if we go back years ago, when we did the flu shot, we always had the ability to continue the flu clinics and have us or our staff bill the insurance companies or Medicare or Medicaid. And with that, you're able to not only cover the cost of the flu shot, but you're also able to cover the cost of the administration of it, the actual injection and all the work that goes with it. So what we're all looking at collaboratively right at the moment is that the city of New Bedford already does bill. So they've already got a good handle on it. But now we're trying to work out a revolving account, okay? Whether it be New Bedford, whether it be Acushnet, whether it be Fairhaven, that all of the towns are interconnected with, so that we can bill now, which is what the pharmacies always did, that did it for us. Bill and reclaim some of that money that we have for obviously the doses, the administrative work, and be able to use that to actually purchase more vaccine at the beginning of next year.
Mm-hmm.
So if we can get all this to spin up, and we can do it, again, even if we can do it collaboratively, or if we have to do it individually, we're all kind of working on it to see how to make it work. We could become very self-sufficient and not have to worry about, digging into the funds, so to say, to try to figure out how to pay for this. It would just spin up over years and get better and better. And the same thing goes with, Christie will give COVID vaccinations too. Those, again, these are things that have to be purchased. The state's not giving it to us right at the moment. Maybe that'll change anytime now. You never know. But these are all things that we're working on.
So what if you run the clinic and you come up 10 short?
Well,
Or you got 10 people calling from housebound people, can we then order more?
yeah, we would
What's
be able
the
to.
lag time on that? And
It's not so much of a problem right now. What we're doing is taking a look at the Council on Aging in Fairhaven, the Council on Aging in Acushnet, because that's pretty much where we've always done our flu clinics, or their flu clinics, and then taking a look at what New Bedford does, because they have clinics, but it's not necessarily directed specifically to the seniors. So right at the moment, as a discussion, we're willing, in a sense, if New Bedford's going to have more capacity, they're going to have more. So in the event that we need more than likely we're going to have it from them.
Okay.
So there's going to be a little ebb and flow to get us started, and that's really what it is. And then if worse comes to worse, then we can buy more. If we end up using out of them, then they'll say, listen, you got to give us 10,
Mhm.
and then we're going to buy 10
Right.
more, and
Yeah.
we'll purchase that. But
Okay.
there's enough vaccine to go around. Just we're still,
Trying to put it all
still in the
together.
water, trying to figure out how all of it's going to go, because we're bringing back things that we haven't really provided in this way in a long time. Which is very much self-serving of the town rather than pulling outside contractors in. So hopefully it goes well. I mean, they usually have two. Heather usually has two, and she said there's about 50 people that come to both. The first 50 tend to be, the over 65, or the second round tends to be the younger people, which those are only $17 a shot for the regular dose vaccine.
Okay. So the second round will probably be in November at some point?
Yeah, I have to work that out with Heather and see what's
Okay.
going to go on with this, but we're,
It looks like it's working out well.
Yeah.
Um,
So again, that'll be high dose vaccines for 65 and older.
yeah, for anybody that's 65 or older gets the high dose, yeah, and then some homebound.
Tuesday, October 10th, which is 1 week from today, 9 a.m. to 11 a.m. at the Council on Aging Center.
Anybody can go. I mean, it's not just the seniors, but I mean, if
Mhm.
somebody else wants to go too. It's really for flu shots.
yeah, I'll make a motion to actually keep that on the agenda for the next meeting, so we can get an update on how everything went.
I'll second the motion. All in favor?
Aye.
Aye. Motion carries. Next on the discussion item, car seat checks, October 27th, from 11 a.m. to 3 p.m. at the Acushnet Library on Middle Road.
Again, we gotta thank Christy. She became certified, certified to basically check car seats, check the expiration dates, and also check the way that they're actually installed.
Safety.
Yeah, and there's actual certification to that. There was several people in the city of New Bedford within her crew that also get certified. So now she wants to bring that out. She's brought it out once already, and did an impromptu kind of car seat check, and it was in the city, and the turnout was pretty spectacular. So she wants to, now address it with the other communities, with Fairhaven and Acushnet and New Bedford. So they've set up, and we're working on right now a flyer that's going to go out.
I was going to say, how are we getting public outreach?
Yep, we're still working on it, but what the plan is to basically do one Saturday, okay, do one evening, and then one middle of the day, one lunchtime. So we're doing the lunchtime thing between 11 and 3. It works out really good over at the library because the library opens at 1. In talking to Elizabeth at the library, she's excited. They're even talking about doing some sort of book reading, because of the kids that might be there between the 1 and 3. But then at the same time, we got from 11 to 1 to be working it out if we get a lot of people over there where there's not necessarily people going in and out.
This is October 27th, a Saturday?
This one is, October 27th is a Friday. We're doing the lunch one.
Okay.
I believe, as it stands right now, New Bedford is doing the. New Bedford's doing the evening, okay, and we'll get those dates. They're all in October, and Fairhaven's going to be doing the Saturday. So this way, and it'll be, available to everybody in both New Bedford. It's just a matter of New Bedford and Fairhaven and Acushnet, whatever is the best place. What is it? Is it better for you to be on the weekend? Is it better for you to be after work? Or is it better for you to be, at lunchtime to jump in? So that's the thought process here.
So the flyers, how were we putting them at stores? Are we hanging them up, or are we?
So the expectation is that we would put them on the website, we would put them on the town's Facebook page, and any other way that we can do it.
Okay.
And the same thing's gonna happen with the city, and the same thing's gonna happen with Fairhaven.
Okay.
So, we're just waiting right now, waiting on the fancy one that's gonna have the town of Acushnet Board of Health, the town of Fairhaven Board of Health, and the city of New Bedford Health Department, all in their making.
Okay.
So we need to
Somebody
get.
from Acushnet could go, if they couldn't make, they could go. to
That's
one
the
of
point.
other.
Yeah, so we can, like you said, trying to make it as convenient. You can't always show up on a Saturday, and you can't always show up after work. And sometimes all you get is your lunchtime, and you run over there, you have your car seat checked, and they look at if it's expired, if there's problems with it, and they basically will help you, teach you, or tell you what needs to be done. And it's great for the.
I remember when I was
It's a good
the
service.
first dad, and I went, my wife sent me down to Rochester Police
Yeah.
Station. They did it. I was impressed with how they get that seat tight.
Yes.
And I would have never thought to, get on it for all your weight and do, it's really educational.
It's a good service.
Yeah, you
Yeah.
really want that thing tight as can be, yeah.
As we go forward, I've already spoke with the fire chief and the police chief, and there's a lot of interest there. And once those classes come back around, I'll toss that out to those guys, and especially the fire department. We'll probably get certified too, which would be more helping hands in doing this maybe next year.
Yeah, good.
Excellent.
I'll make a motion to place it on file, but actually would like to keep it on the agenda and discuss it, see how it goes.
Sure.
For the next meeting.
I'll second that motion. All in favor?
Aye.
Aye. Okay, my motion carries 2-0. Last, we have service animal memo and signage to be distributed to bars and restaurants. Review of matters presented, votes may be taken. Is that one?
Some-
Is this the sign right here?
Yep, so these are the signs based on our previous conversations.
Nice and
Those were the
clear.
signs that I was able to come up with. I thought it would be a good idea to, put some basic information together for the managers or for the owners so that they really kind of get a concept behind what's going on here and that they can ask questions. So I put together a memorandum that I would like to have you guys initial. If you see fit, we can just initial it at the Board of Health. And then I'm gonna distribute the memorandum with the signs
Yeah.
out to the
Just so
different
they
locations.
understand
Yeah.
where we're coming from, why this is going on.
Yes.
Because I brought this to the attention of the board a couple of meetings ago. And
Certainly.
Joe did a good job in Wander putting that together, so, yeah, we make a motion that we get that out to the restaurants and bars and,
I'll second the motion. All in favor? Aye. Motion carries 2-0. Is there anything else, Joe?
Nope.
all right,
Is there
I'll
any-
make a motion to adjourn.
I'll second the motion. All in favor?
Aye.
Motion carries 2-0 at 5:17.